Good afternoon. I'm Travis Gayles, CEO of Howard Brown Health, and I'm coming to you today to reaffirm our commitment to being an excellent, high-quality healthcare provider. Let me first say thank you for allowing us to be a part of your healthcare journey. I'm reaching out today to remind you that we as an organization believe in science and evidence-based clinical practice. All of our clinical service delivery models are consistent with the most up-to-date clinical and scientific standards as recommended by the relevant medical and clinical societies. These practices are long-standing and have demonstrated significant impact in improving health outcomes for decades. Whether we're talking about the most up-to-date treatment protocols for conditions such as diabetes, HIV, dental practice, sexually transmitted infections, or behavioral health care, we strive to ensure that you, as our patient, have access to the most appropriate, relevant clinical management practices. Recently, some of these practices have been called into question, and I want to make sure that you, as our patient, understand where we stand. First, in the area of vaccines. Vaccines across the board have been effective tools at preventing the onset of illness and mitigating symptoms in other cases. They have worked for years and continue to offer protection for a host of conditions. The data is clear on the efficacy and effectiveness of vaccinations. We stand by the recommendations of the American Academy of Pediatrics, the American College of Physicians, and the American Association of Family Physicians, and will continue to recommend and offer vaccines per those evidence-based and data-supported guidelines. Secondly, there was a recent reference to using Tylenol and a link to causing autism. As a healthcare provider myself who has prescribed and used Tylenol in a host of different clinical settings, there is no data that I am aware of or that has been vetted and published that confirms such a link. I raise these concerns because unfortunately, when misinformation is spread, many folks lack reputable resources to answer the questions they may have and subsequently make decisions that negatively impact their health. I'm sadly reminded of a situation when I was a health department director during COVID. There was a reference to drinking bleach to cure COVID. Well, some of us may laugh at that and question that. A lot of people out there believed it because someone on TV said it. We want to make sure that our patients have access to evidence-based information and that we as an organization are a source to answer your questions. So please contact your primary care provider with any questions that may arise in the flurry of new information as it relates to some of the above clinical practices. Thank you again for allowing us to be a part of your healthcare journey, and be assured that we are doing all that we can to ensure that you have continued access to affirming high-quality, evidence-based clinical care. Thank you, and have a great day.